30 years of doing dentistry, I have seen so many patients with mouth with a disaster. Try to find out what is the reason why they have a problem. It's not just one reason, there are multi-factors. So many factors working with them. But the major factor I have noticed was their childhood bad experience. If anybody has a bad experience during the childhood, their parents drag them to the dental chair, dentist put them in the chair, then tie them up and then just do it, the work with the force. Kids are crying and screaming. I mean, that's a brutal way to do the dentistry. We need to change that. We need to change and win the kids' confidence. The only way to win the kids' confidence is don't force them. So I developed a system. Just like kids, when they go to grandpa's house, how much they have fun. So I have created a situation in my office so that kids can have a fun like a grandpa. What do they get in the grandpa's house or grandma's house? Usually they get toys, gifts and food. So I have created the same situation in my office. Kids, we don't see them on the first visit for dentistry. We give them a toy. Once in a while we give them parents, we tell the parents to bring their favorite toy and their favorite food. I remember one kid, he's 4 years old. When he came for the first time, before he came, I told mother was my patient, so I told mother, when he comes, can you please bring his favorite toy? I did not know the story, but mother bought one race car which he liked it. So when he came in the office, when I gave him the first visit, when I gave him that race car, he was jumping up and down in the chair. He was almost jumping to the ceiling. He hugged me and said, Dr. Shah, thank you, Dr. Shah, thank you, 3 times. In a whole visit, he hugged me 3 times and thanked me 3 times. 4 years old boy, visit somebody for the first time and have this much of bonding. It is that small toy which plays a great role. So I have a suggestion to all the parents that when they go to their dentist for their child's first visit, they should take the toy of their kid's favorite toy and the food and hide it in the bag and give it to the dentist and tell the dentist to give it from the dentist side. So kids will have a good bonding with them. So the important part happened to this child which I'm telling the story is, it is not just he was very happy and we had a good relationship and good trust, but also when the child was sitting in the chair, mother complained and kind of told me that he has a habit of drinking the milk at the night time before he goes to bed. So I said, okay, let me handle that. So I told the child, and I told him that this is not good, because if you drink the milk at the night time, the sugar bugs will come and will cause the problem with your teeth, and you will have an avi in your teeth. And the kid listened to me very carefully. I said, you should drink the water instead of that. Listen very carefully. Couple of nights he drank the water. The 3rd night he threw a fit. He started crying and mother said, okay, do you remember what Dr. Shah said? And he immediately kept quiet and he drank the water. So mother used this as a tool. I'm not sure this is going to work for every case. It doesn't work every case. But at least in this case it worked very well. So if he doesn't do homework, if he doesn't behave, he says, do you remember Dr. Shah said do this and do that? It worked very well. Where did this came from? It came from the trust. So when child trusts the dentist, they usually trust their parents or grandparents. When they trust their dentist, it works very well.